I am an optometrist associated on staff with the Department of Ophthalmology at the University of Texas Health Science Center in San Antonio. I'd like to start by going over a little bit of ocular anatomy. We'll start from the top. This is an illustration from a famous medical illustrator, Dr. Netter. I've added some extra blocks in there that are associated with aging. Now, as we look from the top down, the way we see light enters the cornea, it passes through the pupil, then through the crystalline lens, and hits the retina in the area called the fovea. The areas I've highlighted that are associated with aging, let's look first at the angle or the trabecular meshwork area. The eye has an angle that forms between the cornea and the iris. If this area becomes crowded, the fluid that's produced in the eye cannot exit and the pressure will build up and cause narrow angle glaucoma. A lot of medications that elderly people take will dilate the pupil as a secondary side effect, and this can cause this angle closure glaucoma. Next, as we go through the pupil, you'll see the lens of the eye. The lens of the eye from birth is clear, but as we get older it becomes cloudy. When it becomes cloudy enough that light does not pass through and it interferes with vision, it's called a cataract. As the light passes past the lens into the vitreous is a gel at birth and slowly becomes more liquefied with time. At a certain age it will tend to disconnect and can cause retinal problems. Then light strikes the retina, specifically in the area of the fovea. The fovea is the center of the macula. The fovea has the most important area of the vision, and this is where we get 20/20 vision. Unfortunately, a lot of eye diseases occur in this area. And then as the light hits the retina, it's turned into an electrical impulse and travels down the optic nerve to the brain where it's interpreted as vision. A lot of patients ask, what is visual acuity when I say I have 20/20? Well, visual acuity is expressed as a fraction. The numerator is the distance at which the patient reads the chart, and it's usually 20 feet. The denominator is the distance at which someone with normal vision reads the same line on the chart. For example, a patient that has 20/60 vision compared to a patient that has 20/20. If you have 20/60 vision, a patient who has 20/20 vision can stand away 60 feet and see the same thing that you're required to see at 20 feet. Most eye charts go up to about 2200 or 2400 vision. So the higher the number on the denominator, the worse the visual acuity. Some people cannot see the big E on the eye chart, so we have them walk forward. And again, the numerator, if they can go up to 10 feet and still see the 2200 letter, we classify that as 10/200 vision. Some people cannot see that well, and so we hold up our fingers and ask them if they can count our fingers. So we might say, yes, they can count fingers at 3 feet. Some people don't have that type of visual acuity. So next, we wave our hand in front of them, and if they can see motion from the hand, we'll say hand motion at 2 feet. Some people can only see light. If they see light, we call that light perception. And those unfortunate individuals who have no light perception, we just call that NLP. Now, just for your information, the government considers legal blindness as the best corrected visual acuity in the better eye of 2200. This is for tax purposes and other individual things that might pertain to you as far as being reimbursed. Also, you can have 20/20 vision but have a field of vision down to 20 degrees.